Thanks, Cahill. Can I just double check that this is the question in relation to the white paper and the Ombudsman report? It is, okay, because I had my own question in order incorrect. So, Minister, this question is kind of following on from the discussion that we had here, I think it was 2 weeks ago now, in relation to Dr. Niall Muldoon's report, the Ombudsman for Children. Just, I suppose, some of the recommendations that came up in that report, just to give us the opportunity to discuss that again. And in relation to the white paper on end and direct provision, and if you can just give us some more information or any timelines in relation to that. Thanks.
Thank you very much, Deputy. So as of the 5th of December, approximately just over 100,000 Ukrainian nationals have been granted temporary protection in Ireland, and as you know, we're accommodating about 75,000 of those in state-provided accommodation, and we're also accommodating just over now 26,000 people in the international protection system. And I suppose in that context, the underlying assumptions upon which the white paper, which was published in February of 2021, need to be examined. That foresaw 3,500 people arriving into the system per year. Last year we saw 15,000. This year we'll probably see about 13,000 into the system. With regards to the steps my department are taking to address some of the recommendations in the Ombudsman for Children's report, I'd like to state maybe the following. So the department is working to procure new accommodation and transition current residents from emergency accommodation centres to more permanent accommodation within the portfolio, and the revised white paper implementation approach will focus on increasing the state-owned permanent accommodation capacity to build an appropriate system to meet an increasing need. With regard to the recommendations for IPAS to put in place a robust quality assurance mechanism, including an independent inspectorate, my department has put in place a number of measures to address concerns which include monitoring of permanent centres for adherence to national standards, the vulnerability assessment programme, resident clinics, the publication of the revised IPAS Child Safeguarding Statement, the provision of child protection briefings to managers and staff at IPAS centres, and finally, with regard to the third recommendation, IPAS will continue to prioritise children and address their vulnerabilities in accordance with the requirements of the EU Reception Conditions Directive. IPAS will continue to engage with all staff and centres that accommodate children in the international protection system to ensure they complete children first training, have a designated liaison person assigned, and adhere to the Children First legislation and guidance.
Thanks, Cathaoirleach, and thanks, Minister. Yeah, as we've said before in this chamber on the day of that debate, we really are very lucky to have Dr. Niall Muldoon and his team. And I just think, I suppose, when he highlights an issue, he really does it because it needs to be highlighted. And we have so many children, as we know, living in direct provision, and it's a combination of children who are here, I suppose, as unaccompanied minors. That is I suppose, the combination of the most heartbreaking and the most worrying, because obviously they don't have an adult or a family member looking out for them. And then we have children who are here maybe with family or with some of their family at least. So I do think it's really important, that we are taking every steps, and I particularly want to focus on what you said there in relation to one person sort of designated or dedicated to looking, if I've picked that up correctly, one person in each, let's say, centre that is specifically for children, that I suppose they can maybe go to raise awareness. Is that something we currently have, or is that something we're bringing in? Sorry, if you can maybe expand on that, because I think that's a good idea and a very good point, because I think that will sort of alleviate a lot of the issues and the difficulties.
So, Deputy, just to answer that question, in terms of, in the same way that a school has to have a designated liaison person in terms of their implementation of Children's First, so do IPAS centres which have children there. Obviously, not all have children there, but those that do have to require that, and we have an officer in our department making sure the compliance with that, because that is absolutely essential. Look, the work the Ombudsman for Children has done in terms of, I suppose, highlighting imperfections, and there are many imperfections in the system, I absolutely recognise that, and working with our department to improve them is really important. His focus in the report we discussed were on children within the system, usually with their parents, and there is work taking place there in terms of the work we're doing with the CIPSEs, the Child and Young People's Services Committee all over the country, to do more in-reach into international protection accommodation where there's children, and also work we're doing directly with TUSLA in terms of the use of new family support workers who go into international protection centres where there are children and work with the parents there in terms of providing additional supports.
Thanks again, Minister. Yeah, I think the other point I wanted to, and thanks for clarifying that point in relation to the designated person, the state-owned accommodation, and I think this is probably a point that you would share. I think that's really where we do have to go, because obviously, you know, in an emergency situation or when something is just unfolding, you have to respond in kind of real time, and there is situations, but I suppose we're all being very honest with ourselves. There's a lot of people making, you know, significant amounts of money from this, and there's always going to be a question mark. And I would say that as well in relation to anything in relation to care, whether it's some of the more you know, I would like to see a situation, for example, in the foster care system where we only had state-owned facilities, or that we have foster families. We're not looking at the private sector. I don't think they're, you know, those two things should be together. And it's the same in relation to this. And I know there has been some moves, but if there's any other information that you can give us in relation to, I suppose, how exactly you see that rolling out, or how you see us acquiring more state-led and state-run accommodation. Thanks, Cathaoirleach.
I've been very clear that I believe in terms of what is into the future going to be an obligation on the state to accommodate a growing or an increased number of international protection applicants from what we were dealing with in the last 10 years. We need to have a much higher percentage of that, of those applicants accommodated in state-owned accommodation. Where we have state-owned accommodation, we've better control over the conditions, we've better control over the location as well, and we can locate these around the country rather than having accommodation focused in particular areas. But also importantly, there is a value for money issue as well, as you raised there, and certainly when you look at it over about a 10-year period, the state makes a saving if it puts in the capital investment in terms of state-owned accommodation rather than using private providers. I think going forward, because of the very significant increase in the number of international protection applicants, it will have to be a mix. There will be some private providers continuing to provide accommodation, but we have to grow that state-owned element where we have much greater control of conditions, of location, and we can plan it much better, but also in terms of ensuring value for money for the taxpayer as well.